So, we wanted, before we go around to some of the speakers we have for this evening, we want to just define what we mean by a local model or a local solution. As Hanan was saying, there's a lot of information out there for people who are trying to move through this process. A lot of names, FTHP, IMGs, even to describe this group, there's a lot of names. So what we are suggesting is, and what we're actually doing at Community Matters, is trying to put that information in context, right, in this inner circle, and to have a community hub for people to come and to get support from other people who are going through the same situation, looking for daycare, looking for housing, trying to figure out immigration. It's in context so that people have a chance to move forward in terms of what their plans are, or maybe other plans, if that may be the case. So, what we're saying within our job club, we have the capacity, much more capacity now, to give people options in terms of retraining if they're thinking about it. But it's in their local environment where they can get that information. They can define their personal goals, so it's not just around their family and all the other pressures, but what do they want to achieve as a health professional over the next 5 years. Neighborhood networks are powerful here in St. Jamestown. We have 67 cultures, and I think there's more that goes on between cultures than between St. Jamestown and the rest of Toronto. There's powerful social networks in this area. People don't know about financial subsidies and grants, right? I mean, there's so many stories where people have spent $10,000, $15,000, $40,000 going to different colleges where they think that is where they should be learning, and they don't have the advantage of someone who neutrally presents them with the different options that are available. For spouses, we think it's important to have that integrated at the community level. And most recently, we have been running what we call a healthy living project. For the past 4 or 5 years, we started with nutrition training, and then now it's exercise. It's moved to self-help programs. We started screening for diabetes and cancer, the risk of diabetes and cancer, and we've linked it all with a health passport, which helps people to sort of walk through the system over a 3 to 5 year period. Right? It's the idea that we provide follow-through for people in terms of what their goals are. So when the foreign trained health professionals started to move, we thought, what an opportunity for people to give back to their community, but also to be able to be involved in a work environment, be involved in their community, and then we help them to move up and out. So we have 2 people this evening, an OBGYN from Nepal and another one from Dubai. First you are. Egypt, there you are, sorry. Who have worked with public health to put together an approach to cervical cancer screening, which takes into account their cultural context. Right, so we don't just try our Canadian approaches, and we think it's very, very important for us to figure out how do we achieve cultural integration using the information that our people are bringing from back home about how people take care of their health. So we don't just prescribe Canadian over-the-counter drugs, but we understand that people have other ways of dealing with their health and to respect that. So it's a wonderful opportunity for us, and it's a little testing ground to figure out how do we encourage people. We did training for this Healthy Living Project last year. 8 people that we trained, 2 of them have gone back home, of these 8 foreign trained health professionals. One of them just got back actually today. Another one is a nurse, she's qualified to be a nurse, and 5 of them are now doing volunteer work with us here at Community Matters. So the challenge is for us to work with you to move into this next phase here of understanding how do we link with Health Force Ontario, with Culture Link, with Triac, with the other different groups that are involved, the different colleges, so that we give them people a learning ladder, a step up and out of St. Jamestown, if that's what they want to do, or not. So that's where we're saying we think that 80% of the solution is here in the community, and we always say 20% is that the smaller sort of ring that is around. Okay? So in conclusion, around this particular group, we started with the idea that there was a lot of inequity in terms of the number of foreign trained health professionals that were passed their licensing exams, that had access to residency positions, and we're wrong, right? And that's why we're here this evening, to learn more from everyone involved, because there has been more of a level playing field. Now, there's always inequities, and we don't want to go into all of those details this evening, so there's always work to do in terms of trying to make things better. But we think the challenge for us is to prepare people for a very competitive environment. Whether you're Canadian or coming from another country, that's what I think our job is at the local level, is to work with employment agencies and that kind of approach with the information and with community to define a local model. So that's our thinking right now. Our group is also involved in, we're planning a bus trip to Northern Ontario, because that's where we think the jobs are. And we want to put people who are ready to seek employment, but go with their families and just learn about what it's like to live in the rest of Canada. Right? Many people think that Toronto is Canada. We come here to St. Jamestown and we want to open the horizons. We want to bring mentoring opportunities, work with George Brown as we have in the past with their partnering office, so we have some on-site classes, and have a working group which meets at least on a monthly basis, which is broader than our small St. Jamestown group, to achieve some of these priorities.